Good afternoon, ladies and gentlemen, distinguished guests, respected professionals and friends joining us here today, in person and our respected participants connected online from different parts of the world. A very welcome to you all to the ISSUP Bangladesh Chapter launching ceremony, hosted by Dhaka Ahsania Mission. I would like to request all of our respected guests to kindly take their designated seats as we are about to begin our program. On behalf of the host organization, I'm Rakhi Ganguly, senior psychologist, and it's my great pleasure to steer you through this important and historic occasion as we officially launch the Bangladesh chapter of the International Society of Substance Use Professionals, ISSUP. Ladies and gentlemen, today marks a significant milestone in strengthening professional collaboration, promoting evidence-based practices, and building a coordinated national response to substance use challenges in Bangladesh. Before we formally begin, I kindly requested everyone to take your seats and to keep your mobile phones in silent mode, as we are about to begin our program shortly. And our online participants, please make sure your connection is stable and your microphone remain muted unless invited to speak. Thank you for your cooperation. I would like to give a brief overview of ISSUP and the host organization before we move on to the main session about ISSUP Bangladesh. ISSUP Bangladesh serves as the national chapter of the International Society of Substance Use Professionals. The chapter aims to strengthen professional capacity, promote evidence information, prevention and treatment approaches, and facilitate knowledge exchange at both national and international levels. It will serve as a platform connecting professionals, researchers, policymakers, service providers, and organizations working in substance use prevention, treatment, recovery, research, and policy advocacy across Bangladesh. Aligned with ISSUP's global vision, the chapter will work to uphold professional standard, support policy dialogue grounded in public health principles, and foster collaboration for improved public health and well-being. About the host organization, the ISSUP Bangladesh chapter is hosted by Dhaka Ahsania Mission, a nationally and internationally recognized non-government organization established in 1958. The health sector has been working in the field of drug prevention since 1990 and later expanded into treatment, rehabilitation, and integrated care. With multiple treatment and rehabilitation center counseling services, including Monojogo Kendro, and strong collaboration with national and international partners, Dhaka Ahsania Mission continues to play a leading role in addressing substance use as a public health issue in Bangladesh. Now, to formally begin our session, we will have the welcome speech and presentation on the host organization. It's my pleasure to invite Mr. Iqbal Masood, Director, Health and Voice Sector, Dhaka Ahsania Mission, and Member Secretary, National Advisory Committee, ISSUP Bangladesh Chapter, to deliver his welcome remarks and present an overview of Dhaka Ahsania Mission.
Thank you, everyone, especially Olha, ISSUP Global Representative and National Chapter Coordinator, and distinguished guest, Honorable Chairperson Professor Mohit Kamal, President Dhaka Ahsania Mission Professor Dr. Ghulam Rahman, Honorable Vice Chairman of Dhaka Ahsania Mission Dr. S.M. Khalilur Rahman, our advisory board member Johid Ahmed, and clinical psychologist, Honorable Dr. Selim, John Selim, former residential psychiatrist, Central Drug Treatment Center, Narcotics Control Department, Honorable UNB representative and UNOTC program manager, Mr. Tahir, and all participants and DAM colleagues. this is a great moment of Dhaka Ahsania Mission. Since 99, we started in drug prevention and control program in Bangladesh, and it's a long history: prevention, treatment, advocacy, policy dialogue, and we working national level and also international level. So this is a pleasure of Dhaka Ahsania Mission to join ISSUP Bangladesh Chapter as a host organization. And since 2015, ISSUP launched in Bangkok, and Bangladesh team, and we also there. And after that, we collaborate informally many ISSUP events in different countries and also Bangladesh, and join webinar, organized conference. But now these days, opening a new horizon to collaborate with the ISSUP Global for formal collaboration. So I'm going to briefly present Dhaka Ahsania Mission, about Dhaka Ahsania Mission. You know, the Dhaka Ahsania Mission is established in 1958 by the Honorable Educationist Hazrat Khan Bahadur Rasulullah. He was under Undivided Bengal and in the British period as a highest education position he held, and he worked to reform education system in Undivided Bengal, Bangladesh, Assam, and Bihar. And after his retirement, he formed Ahsania Mission in his village in 1935. After that, he established Dhaka Ahsania Mission in 1958. Since then, Dhaka Ahsania Mission working for the people, especially for the disadvantaged people. And our motto is divine and humanitarian service. So at present, our presence in all over the country, 64 districts, we are operating different projects and operating 40 projects and 35 institutions like 3 universities, 2 cancer hospitals, 5 drug treatment and rehabilitation centers. We have a school, college, and many more institutions. And we have a consultative status with UN, ISSUP, and UNESCO. We collaborate since long. Next. And Dhaka Ahsania Mission, when started drug prevention and control program in 99, that was named as AMI, Addiction Ahsania Mission Madokata Protirodh Niyantron Karmosuchi. It's a voluntary organization, and that time Dhaka Ahsania Mission formed 402 voluntary organization in the community level with the presence of youth. And Dhaka Ahsania Mission role was to provide training, material support, and mobilize them to work against the drug traffickers and also drug use. After that, Dhaka Ahsania Mission started with treatment center in 2004. And firstly, Dhaka Ahsania Mission, with the collaboration of UNESCO Paris, established Ahsania Mission Drug Treatment and Rehabilitation Center in Gazipur. After that, in 2010 in Joshua, and 2014 for the female in Dhaka, Female Drug Treatment Center, Treatment and Rehabilitation Center. And last one, established Munshiganje Monojatno Kendro in 2021. And next month, we are going to establish another treatment center for the female drug dependent in Sabar, Birulia Sabar. It's very close to Dhaka city. And our model is a science-based model. And it's a mixed model, a multi-dimensional model. We follow medical detoxification, residential treatment, integrated care model, psychological support, vocational training and skill training, family intervention, tobacco-free environment, telemedicine service, and staff capacity development. Also, this is main horizon of our activities. And prevention activities is a community activity. We work with the education institute, especially school, college, and universities, and we provide training and develop materials, ICDCC materials, and we also conduct a family education, tobacco control program, HIV prevention program for the injecting drug user. Under the Global Fund, we are implementing 2 projects one for the PUD, people use drugs, and also the women drug user funded by Global Fund and Canada Healthcare, Big Healthcare. And we also accredited a training provider in Bangladesh with the Colombo plan. We provide UTC, Universal Treatment Curriculum Training, and also the Child Curriculum Training, and we are going to start Women Drug Treatment Curriculum Training of Colombo plan. We have a strong recovery groups. We have a self-help group for the female, it's called AINA, and male self-help group is a Hope Club. They work for the recovery people and also the community level organization, and provide different type of awareness, organize different type of activities through recovery engagement. Ahsania Mission Ahsania Mission Youth Forum for Health and Well-being is another initiative of Dhaka Ahsania Mission. This forum established for develop capacity for the youth, and more than 500 youth at present working with this forum of Dhaka University and other public and private university students working with this forum. And this forum also organized different type of dialogues and campaign program in the university level and the policy dialogue in the policy level, and then met with the policymakers to reform the our policies and law and rules and the voice of the youth population, because you know the youth are the highly vulnerable for drug use and adolescents also. So we engage effectively. We engage the youth population to mobilize the people against drugs, and we are the successful. Now I'm coming to some memories that this is the beginning of the ISSUP in Bangladesh, ISSUP in Bangkok. It's the first ISSUP meeting conference in Bangkok, and that conference the INL and US State Department launched the ISSUP globally. And in Bangladesh team, big Bangladesh team was there, and 4 of our Dhaka Ahsania Mission colleagues present at that program in Bangkok. So this is the pathway and history of. And next, we met the ISSUP team. All right, you are seeing your picture with Bangladesh team. Director General of Narcotics Control, Sobut sir was present, and Johid Bhai and Rahanul Bhai and Narcotics Department representative was in. This one is Abu Dhabi program, and we actively participated in ISSUP conference in Abu Dhabi and also Greece and other countries. Bangladesh was very vibrant, and that meeting, Bangladesh team shown interest and with disease and narcotics control to open Bangladesh National Chapter. So that time we started our dialogue with the global team to open ISSUP Bangladesh Chapter, but it takes time to establish. But now we are in the final stage. Today we are going to open. This was the brief about the Dhaka Ahsania Mission, and Dhaka Ahsania Mission engaged with the ISSUP Global and ISSUP Bangladesh team. We are going to open. This is our brief presentation about Dhaka Ahsania Mission. Thank you. Thank you all.
Thank you, Mr. Kamal Masood, for your insightful advice and for highlighting DAM's long-standing commitment in prevention, treatment, and rehabilitation. We now move on to our distinguished speaker for welcome remarks. I would like to invite Mr. Bahauddin, Deputy Director, Department of Narcotics Control, Ministry of Home Affairs. We will connect with him online and listen to his speech.
Assalamu alaikum. Honorable Chair, Professor Dr. M.A. Mohit Kamal sir, distinguished guest, respected Joan Travis Roberts, Chief Executive, International Society of Substance Use Professionals, representative from the U.S. Department of State's Bureau of International Narcotics and Law, from the United Nations Office on Drugs and Crime Bangladesh, development partners, professionals, and friends. It's a privilege to address this distinguished gathering at the launch of the International Society of Substance Use Professionals Bangladesh Chapter. Today marks an important milestone in strengthening Bangladesh's national response to substance use through professionalism, coordination, and evidence-based practice. I would like to formally express our strong commitment to support the International Society of Substance Use Professionals Bangladesh Chapter in its mission to professionalize and strengthen the addiction, treatment, and prevention workforce in our country. We know the drug-related challenges are evolving and increasing complex. They impact public health, social stability, and national development. Addressing them requires a balanced and comprehensive strategy, integrating supply reduction, demand reduction, treatment, rehabilitation, and sustained recovery support. The government remains committed to balanced approach in the line with our national drug control strategy. We recognize that effective demand reduction and treatment service depends on a skilled, ethical, and well-trained workforce. The standardized, science-based training improves service quality, ensures dignity and respect to client, and leads to measurable and sustainable outcome. Therefore, strengthening human resource capacity is not we see the International Society of Substance Use Professionals Bangladesh chapter as an important partner in building a competent and national recognized addiction professional workforce. Though coordination and collaboration, we can create a sustainable system that ensure quality, accountability, and compassion in the service delivery. Sincerely thanks Dhaka Ahsania Mission for hosting the International Society of Substance Use Professionals Bangladesh chapter, and I also extend our appreciation to our international developed partners for their continued, continued technical and strategic support. I would like to thanks to all of you for hearing me in passion. Thank you all. Assalamu alaikum.
Thank you, sir, for your valuable remarks. Now, to provide us with a global perspective, it's my great pleasure to invite Ms. Zoana Travis-Roberts, Chief Executive of ISSUP. She will present on ISSUP Global and its objective. Distinguished guest, National Chapter Coordinator, Olha Maishakivska, is giving presentation on behalf of Zoana Travis-Roberts. She will present on ISSUP Global and sub objective. We will connect with her online and listen to her presentation.
Dear esteemed delegates, dear colleagues from ISSUP Bangladesh, dear ISSUP members, it's really a great privilege for me to be invited to talk to you today on this occasion to launch the ISSUP National Chapter in Bangladesh. And my name is Olha Maishakivska, and I work for ISSUP as a National Chapter Coordinator. And today I will provide a short overview of ISSUP on behalf of Zoana Travis-Roberts. And unfortunately, she was not able to join us today and send her sincere apologies. I would like to also pass on the best wishes to all the staff at ISSUP Global. So I'll share my screen, just a second. And hopefully you can see my presentation. So ISSUP is a global international network that brings together people working in the field of substance use. And our mission is to make the work of our members as impactful and effective as possible. And we support this by providing free access to the latest knowledges in the field, best practices, training opportunities, and professional networking. ISSUP is not only for professionals, and we welcome everyone who wants to contribute to this field, including specialists, youth volunteers, policymakers, law enforcement representatives, and people working in supply control. And just last week, ISSUP reached an important milestone of 50,000 members worldwide. And over the past few years, with a growing number of activities and initiatives, our membership has been increasing very quickly. The largest share of ISSUP members come from the Asia region. And I'll tell you this later, but we can see the increasing number of members from Bangladesh. ISSUP is fully funded by the US Department of State Bureau of International Narcotics and Law Enforcement Affairs, and we also work in cooperation with key international organizations, including the United Nations Office on Drug and Crime, the World Health Organization, the Organization of American States, the European Union on Drug Agency, and so on. ISSUP work is organized around 4 main pillars. So we have digital, training, national chapters, and events. So the first, digital, ISSUP has a constantly growing website that is now available in 6 languages. And there you can find the latest research articles, webinars, podcasts, publications uploaded by ISSUP members. By becoming an ISSUP member, you gain an access to online learning hub where many free online courses are available, and through the ISSUP newsletters, ISSUP members receive updates from national chapters, from youth initiatives, and ISSUP global activities. Another important resource is Share. It's a large library that currently contains more than 5,000 resources covering a wide range of topics, and our members can find the latest UNODC, for example, reports there. ISSUP also gives opportunity, let's say, our members to join different networks and connect with colleagues from other countries. And if the topic is missing, our members can even create their own network. One of the newest and most popular initiatives is the ISSUP Exchange podcast. And through this podcast, everyone can hear directly from leading experts who are bringing positive change to the field. And recent episodes feature Professor Stephen Rolnick, and I'm sure you all heard about motivational interviewing from Joanna Travis Roberts, and you can hear about her way to become the ISSUP lead from Professor Nadine Harker and Dr. Zili Slobodan. So by joining ISSUP, you gain access to continuous professional development opportunities and different job opportunities, I would say. So by, sorry, it's skipping all the time, I'm sorry. The second pillar is training. And ISSUP provides a wide range of training opportunities through the online learning hub and also training resources. And this includes a universal curricula for prevention, treatment, recovery, as well as materials, training materials on working with specific population, for example, such as adolescents. ISSUP also offers its own training programs, and one of them is INA Plus, or Introduction to Evidence-Based Prevention. And this course introduces the essential principles of substance use prevention. This course was developed by Charles University in Prague and is based on the European adaptation of Universal Prevention Curriculum. And ISSUP expanded this program by developing INEP Plus, which trains facilitators from national chapters so they can deliver prevention courses in their own countries. I'm sure you hear about this course. Another course is Investing in Evidence-Based Prevention, IEP. This course provides a basic understanding of prevention science and explains what evidence-based prevention means. It also helps participants review what works and what doesn't work in substance use prevention. This course is particularly designed to build networking among policymakers, decision makers, funders, interested in substance use prevention. The third pillar is ISSUP national chapters, and we are really very proud of them. And national chapters play a very important role in ISSUP. They act as a national focal points for prevention, treatment, and recovery support, helping to professionalize the workforce at the country level. And national chapters also ensure that ISSUP work is relevant to different cultures, environments, and national contexts. And currently, ISSUP has 44 established national chapters worldwide, including 10 in Asia. And our national chapter team is continuously working on establishing new chapters, and we expect several new launches in Asia region this year. Yes. So finally, the fourth pillar is events, and ISSUP organize both online and in-person events. We regularly host webinars that are free for everyone to attend. We also organize international conferences and regional events around the world, and the more recent global event was hosted by ISSUP Indonesia. We are also very pleased to invite everyone to our next in-person global event, which will take place on 24th, 26th June 2026 in Accra, Ghana. So we are meeting in Africa this year. And in addition to this activities, ISSUP supports the global workforce in many other ways. We warmly encourage you all to join ISSUP and to explore all the opportunities that our network offers. This was just a very brief overview, and the ISSUP Bangladesh National Chapter will now develop its own activities and initiatives to support ISSUP members in the country, and we wish you every success. And once again, congratulations on the establishment of ISSUP Bangladesh. Thank you very much.
Thank you, Ms. Olha Maishikivska, outlining ISSUP's global mission and its alignment with Bangladesh's national efforts. Youth engagement plays a crucial role in shaping a healthier and more resilient society. I now invite Ms. Marzana Muntaha, Coordinator, Ahsania Mission Youth Forum for Health and Wellbeing, to share the youth perspective.
Thank you, Ms. Rakhi Ganguly. Honorable Chair, Professor Dr. M.A. Mohit Kamal, respected Vice Chair, Dr. Lutfur Kobir, respected Governor Travis Roberts, Chief Executive of ISSUP, Olha National Chapter Coordinator, distinguished representatives from the U.S. Department of State, Bureau of International Narcotics and Law Enforcement Affairs, from the United Nations Office on Drug and Crime Bangladesh, respected guests and dear friends. Assalamu alaikum and good afternoon. It is a privilege to speak today on behalf of the Dhaka Ahsania Mission Youth Forum for Health and Wellbeing at this great event. The launch of the ISSUP Bangladesh chapter marks as a new chapter not only for professionals but also for young people across our country who are committed to build a healthier future. For Dhaka Ahsania Mission, prevention has always been the heart of our work. Through our youth-focused programs, we engage students from schools, college, and universities with evidence-based prevention initiatives. We work to build awareness about substance use risk, promote life skills, strengthen resilience, and create supportive peer networks. The Ahsania Mission Youth Forum for Health and Wellbeing was formed to empower young people to take leadership in health promotion and social change. Our members are actively involved in policy advocacy, leadership development, and campaign programs that address substance use prevention and overall well-being. We organize campus dialogues, community activities, social media campaigns, and many more. Many of our young members from universities are already part of ISSUP as individual members. This connection is helping them to gain access to global network at an early stage of their career. It is inspiring to see young Bangladeshis stepping forward not only as volunteers but also as emerging professionals in the field of prevention and treatment. We are excited to work closely with the newly launched ISSUP Bangladesh Chapter. The Youth Forum is ready to collaborate in performing evidence-based prevention programs among young people and within the wider society. We believe that prevention must be science-driven, culturally sensitive, and youth-led wherever possible. We have a strong and active youth network. We stay connected with each other through a WhatsApp group, which allows us to communicate regularly, share updates, coordinate activities, and engage them in ongoing campaigns and initiatives. This platform helps us maintain continuous interaction and encourage youth participation in our programs and advocacy efforts. For us, youth are not just beneficiaries of our program, they are change makers. With proper guidance, training, and opportunity, they can influence peer, shape public opinion, and contribute to policy discussions. Through this forum, young leaders empowered with knowledge, leadership skills, and advocacy tools to address substance use disorder at community, national, and global level. As we celebrate this launch today, we see it as the beginning of a stronger collaboration between professionals and young leaders. Together, we can ensure that prevention efforts reach every campus, every community, and every family. On behalf of Ahsania Mission Youth Forum for Health and Wellbeing, I reaffirm our commitment to work hard in hand with ISSUP Bangladesh Chapter. We look forward to learning, contributing, and growing together in the shared mission. Let us move forward with confidence and unity to build a future where our younger generation can thrive free from the harm of substance use. Thank you, everyone.
Thank you, Ms. Mirza Muntaha, for representing the voice of our young generation. Ladies and gentlemen, we now move to our special address session. Due to time constraints, I kindly request our honorable speakers to keep their remarks concise. Now, we are honored to hear from Mr. Jahangir Alam, Chief Correspondent, United News of Bangladesh, UNB.
Thank you. Honorable Chair, Professor Dr. M.A. Mohit Kamal, respected Vice Chair, Dr. Lutful, President of Dhaka Ahsania Mission, Professor Dr. Prof, distinguished guests, respected Olha Ms. Hakisa, National Chapter Coordinator, ISSUP, esteemed professionals, Assalamu alaikum and good afternoon. It is a great pleasure to note that Dhaka Ahsania Mission has become the Bangladesh chapter of ISSUP. I am honored to join you on this important occasion. Formal beginning of the ISSUP Bangladesh Chapter marks a significant milestone for professionals working in substance use prevention and treatment and for Bangladesh as a whole. The establishment of this chapter creates a national platform to connect professionals, promote global standards, and standard collaboration, reflecting our shared values of service, integrity, and human dignity. I express my commitment to supporting the activities of the ISSUP Bangladesh Chapter through media and communication services in our country. We believe that investing in prevention, treatment, and recovery is an investment in the future of Bangladesh. Our young people deserve guidance, families deserve support, and those struggling with substance use deserve access to professional and compensation care. I extend my appreciation to our national and international partners. Let this launch mark the beginning of a sustained commitment to building a strong, credible, and impactful platform for the country. Thank you, everyone.
Thank you, Mr. Jahangir Alam. Now, we are honored to hear from Mr. Abu Tahir, National Program Coordinator, UNODC, Bangladesh.
Thank you. Good afternoon. Assalamu alaikum. Honorable Chair, Professor Dr. M.A. Mohit Kamal, respected President Dhaka Ahsania Mission, Professor Ghulam Rahman, distinguished guests, colleagues, partners, friends. Thank you so much for your participation. It's really a good chapter for Bangladesh. So I must first congratulate Dhaka Ahsania Mission to take this good initiative, because it's very important for our country. If you look at the current drug scenario and the drug users in the country, we all are aware that there are more than 8.8 million drug users in the country. So it's very alarming for us, as well as if you look at the current government action, this is also kinds of crackdown is going on the drug user as well. So we need to look at it and we act accordingly so that government can really take corrective measures, particularly for drug users. So United Nations, we have a clear-cut mandate on drug prevention, treatment, care, and support. And we have a long working experience with Bangladesh government since 2009. And we have also long working partnership with Dhaka Ahsania Mission. So both Dhaka Ahsania Mission and UNODC, really they have a good knowledge of human drugs, not in the community, but I think including prison and other closed settings. So it's a good asset for as well. So really this knowledge can be scaled up and can be integrated with this ISSUP chapter in Bangladesh, and definitely we will extend our supporting hand as well as knowledge-based support, particularly if we look at the Global Convention on Drugs and Crimes, and also the rules of Nelson Mandela. This is very important for drug treatment as well. So definitely the establishment of the ISSUP Bangladesh Chapter provides a valuable national platform to advance this principle, and definitely it will create opportunity for professionals to connect with global standards and share knowledge and enhance their skills. So on behalf of United Nations on Drugs and Crime Bangladesh, I would like to express our enthusiasm to collaborate closely with ISSUP Bangladesh Chapter. So we look forward to working closely with all the members of ISSUP Bangladesh as well as ISSUP global and regional bodies. So we see the collaboration as a partnership based on shared goals. By aligning our efforts, we can help to improve the service standard for drug users. So I'd like to congratulate the chair and the ISSUP Bangladesh Chapter Advisory Committee and Dhaka Ahsania Mission for the leadership in making this chapter a reality. Today marks the beginning of a new phase of collaboration. So let us continue our work together to ensure the individuals affected by the substance use disorder so that we can receive quality treatment care and prevention support service. Thank you for your opportunity to be part of this important occasion. I wish the ISSUP Bangladesh Chapter every success and future. Thank you.
Thank you, Mr. Al-Tahir. Now we honored to hear from Ms. Olha Maishakivska, National Chapters Coordinator, ISSUP. We will connect with her online and listen to her speech.
Thank you again for this opportunity. Dear esteemed delegates, today we celebrate a very important milestone in Asia, the formal establishment of ISSUP Bangladesh. This is a significant event for many reasons. Bangladesh is not only a large and influential country in the region, but through its national chapter, it will also represent South Asia within the ISSUP global network. The establishment of ISSUP Bangladesh will help foster coordinated regional responses, promote the sharing of the latest knowledge on substance use in the country, strengthen prevention efforts and professional capacity, and support the implementation of urgent initiatives, including in a future early warning system for emerging substances. These efforts are particularly important in a region affected by drug trafficking and its related challenges. In just 2 months since ISSUP Bangladesh was established, membership has increased significantly from 420 to 1,002 members, and this number continues to grow. The rapid development clearly demonstrates a strong interest and commitment of professionals across the country. All of this gives us confidence that ISSUP Bangladesh and its host organization, Dhaka Ahsania Mission, will serve as a vital platform, bringing together professionals dedicated to strengthening and professionalization of substance use workforce. Knowing about Bangladesh's rich professional experience and its active collaboration with national and international organizations, as well as your expertise in the field, it is truly an honor for us that ISSUP has such a distinguished representative organization in your country. We wish you every success and firmly believe in a bright future of ISSUP Bangladesh. Congratulations.
Thank you, Olha Maishakivska. Now we are honored to hear from our Honorable President, Professor Dr. Ghulam Rahman, Dhaka Ahsania Mission.
Bismillahirrahmanirrahim. Honorable Chair, Professor Dr. Mohit Kamal, respected Vice Chair, Dr. Lutfur Kobil, distinguished guests, respected Joanna Travis Roberts, Chief Executive of the ISSUP, Olha Maishakivska, National Chapter Coordinator, ISSUP, representative from the US Department of State's Bureau of International Narcotics and Law Enforcement Affairs, colleagues from the United Nations Office on Drug and Crime, Bangladesh, esteemed colleagues, respected guests, distinguished participants, my salam to you all. It gives me a great pleasure to welcome you all to Dhaka Ahsania Mission on the important occasion. I think it's a great occasion of having wonderful people on the Zoom and also locally. It's a brilliant explanations and speech has been made by them. The launch of the ISSUP Bangladesh Chapter. Well, it gives me great pleasure to welcome you all on Dhaka Ahsania Mission on these important occasions. The launch of the ISSUP Bangladesh Chapter is not only a milestone for the professional community working in substance use prevention and treatment, but also a significant step forward for our country as well. For many years, Dhaka Ahsania Mission has been working in the field of education, health and social development. And those of you who are new to Dhaka Ahsania Mission, may I just remind you that the Dhaka Central Ahsania Mission was formed in 1935, and the Dhaka Dam, Dhaka Ahsania Mission, Dhaka was established in 1958. We have two distinctive mottos, as because in this living world is the testimony with the mind of the Almighty God, Allah, we call him also Allah. And our opponent who built it, Khan Bahadur Asunallah, he was a distinguished scholar, distinguished administrator, have made tremendous contributions in India as well as abroad also. So the two distinctive motto was to build a liaison with the Almighty God. That means you pray to Allah when you have five times prayer in the Islamic faith. In the different communities, they have different rituals, you know. And the second is to serve the community. To serve the community in such a way that it will be free and fair with justice and humanity. So that is the two motto laid down by our founder. Therefore, it aligns closely with our values and service, integrity and human dignity, as laid down by the Dhaka Ahsania Mission. On behalf of the Dhaka Ahsania Mission, I would like to express our full commitment to supporting and facilitating the activities of the ISSUP Bangladesh Chapter. We are committed to providing institutional support, technical collaboration, and the space for dialogue and training. We will work closely with the chair, the vice chair, and the advisory committee, and the standing committees to ensure that the chapter operates effectively and gives sustainability, and with the support and commitment to the spirit of our benign government as well. We believe that investing in preventive treatment and recovery is an investment in the future of Bangladesh. Our young people deserve guidance, and our guidance and our families deserve support, and individuals struggling with substance who deserve access to professional and compassionate care as well. I also extend my appreciations to our national and international partners whose presence here today reflects a shared responsibility. Together, though coordination and knowledge exchange, we can strengthen the quality of service and expand access across the country. You see, the Bangladesh faces a very unique problem. You see, little over 60% of our population live in the villages, and nearly 47.5% people live in the urban areas. Urban areas, people who live in the, you see the coral bustings, there are big bustings, you know, but even living is very dangerous and difficult for sustenance. Therefore, these are prevalent in most of the towns in Bangladesh, the problems. And about 40% people live below the poverty line, 20% in extreme poverty. So therefore, we need to strengthen our hand to uplift those communities. Therefore, the treatment, the sustainability, the hand of ISSUP will have to be very strong in coordinating those activities. I also extend my appreciation to our national and international partners whose presence here to reflect a shared responsibility together through coordination and knowledge exchange. We can strengthen the quality of services and expand access across the country. Let this launch not to be seen as a ceremonial event only, but as the beginning of a long-term commitment. Dhaka Ahsania Mission stands ready to walk the journey with ISSUP Bangladesh, ensuring that the chapter becomes a strong, credible, and impactful platform. I thank you all for your presence and your dedication and valuable service to the important cause. May our collective efforts bring positive change to individuals, families, and communities throughout Bangladesh as well as the world abroad. I congratulate your effort and pray to Almighty Allah for the success with glory and satisfaction. May this launching ceremony be at the heavenly stone that we can tackle those problems effectively for the nation as well as abroad. So my sincere congratulations and thanks to all of you who have endeavored to make this event successful. Thank you.
Thank you, Professor Dr. Ghulam Rahman, our Honorable President Dhaka Ahsania Mission, for your valuable remarks. We now arrive at a historic moment of today's ceremony. I invite Mr. Iqbal Masood, Member Secretary, National Advisory Committee, Director, Health and Work Sector, Dhaka Ahsania Mission, to formally declare the ISSUP Bangladesh Chapter Committee.
Thank you. Thank you again, Master of Ceremony, Ms. Rakhi Ganguly. Honorable Chair, distinguished guests, dear audience and journalists, now I am going to announce the ISSUP Bangladesh Chapter committee members' names. The committee has been formed with the representation of the multi-sectoral stakeholder, like expert of the professionals, doctor, psychiatrist, psychologist, counselor, youth, recovery, businessmen, government and non-government representative who are working with the substance abuse prevention, treatment and recovery. The committee has now two tiers. First one is 9 members advisory committee, which is chaired by the Professor Dr. M.A. Mohit Kamal, Professor of Psychotherapy, Psychiatry and Drug Addiction Specialist, former Director of National Institute of Mental Health, Government of Bangladesh. Vice Chair, Dr. Akhtaruzzaman Salim, former residential psychiatrist, Central Drug Treatment Center, Department of Narcotics Control, and Vice Chair Dr. Shahanur Hussain, Chairman Department of Clinical Psychology, University of Dhaka. Member of the Advisory Committee, the Johiruddin, Clinical Psychologist, Psychotherapy Department, National Institute of Mental Health. The Shahidul Islam Helal, former Chairman, BZMA, CIP and businessman, former Chairman of the Promises Medical and Drug Rehabilitation Center in Bangladesh. Ms. Rubayat Firdaus, psychiatrist, Department of Psychiatry, Dhaka Central International Medical College and Hospital. Mr. Abu Tahir, National Program Coordinator, UNODC Bangladesh. Jannatul Firdaus, Consultant Clinical Psychologist, Prof Medical Clinic Limited. And the chapter will host Dhaka Ahsania Mission, and the member secretary of the chapter, myself, Iqbal Masood, Director Dhaka Ahsania Mission, Director Health of Health and Work Sector. To ensure the activities of the Bangladesh chapter, there are some specific area-wise standing committee. Now I am going to announce by standing committee chair names, and chair will co-opt 2 members, renowned workers of substance use prevention in Bangladesh. They are feel free to recruit 2-3 members. So I am going to just chair name. Training and capacity building will be chaired by the Jannatul Firdaus, clinical psychologist and Prof Medical, and she passed ISSUP 2 or maybe 2 international addiction certified addiction professionals. And research and policy advocacy will be chaired by the Mr. Ejazul Islam Chaudhuri, technical advisor, HIV program, National Health and Nutrition Sector, Save the Children in Bangladesh. Membership and networking will be chaired by the Rakhi Ganguly, senior psychologist, Health Sector, Dhaka Ahsania Mission. Treatment intervention will be chaired by the Dr. Akhtar Jaman Shalim, former residential psychiatrist, Central Drug Treatment and Rehabilitation Treatment Center, Department of Narcotics Control. Recovery intervention will be chaired by the Mr. Tanvir Ahmed, mental health professional, and he passed ICAP 2. Now he is working with the Police Rehabilitation Center, OASIS. Admin and financial and logistics will be chaired by the Mokhlesur Rahman, Director of Dhaka Ahsania Mission. Communication and media will be chaired by the Sharbin Rahman, Project Coordinator, Health Sector, Dhaka Ahsania Mission. Youth Focus Program will be chaired by the Ms. Marjana Muntaha, Coordinator, Ahsania Mission Youth for Health and Well-being. This is our initial committee, and this committee tenure is the 3 years as per the agreement with the ISSUP Global. We have an agreement with the ISSUP Global for the 3 years. That's why we are establishing this committee for the 3 years. But it's open for the world. Any expert can join and work with us if they wanted to volunteer work with the ISSUP Bangladesh Chapter. And we also invite many more people in future to join in the standing committee in different activities. So we will collaborate with you. We hope that our national chapter will be successful. Thank you. Thank you very much.
Congratulations to all committee members with applause. We look forward to your leadership and dedication. Thank you, Mr. Iqbal Masood. May I now request committee members to kindly come forward for the official unveiling of the ISSUP Bangladesh logo. We will now proceed with the group photograph. All committee members are kindly requested to remain in front.
এখন তো ওপেন করবে আমরা একসাথেই করি
Please open.
একটু ঠান্ডা
Congratulations to all committee members with applause.
এটা একটু ঘুরাই দাও কোন দিকে
ভাই আমার এখানে একটু টেকনিক্যাল ইয়ে হচ্ছে আমি ক্লিয়ার করে আপনার শুনতে
আমি একটু বলি যে গ্লোবালি এটা হচ্ছে যে 42টা দেশের উদ্বোধন 41টা দেশ আগে হয়ে গেছে বাট দিস ইজ দ্য ফার্স্ট অর্গানাইজেশন উই আর ওপেনিং ইন পারসন অন্যগুলো সব ভার্চুয়ালি হয়েছে বাট আমরা হাইব্রিড অনলাইন এন্ড ইন পারসন
ব্যাকসাইডে লাইট অফ করে হ্যাঁ অলরাইট বাংলাদেশের পাশেই
ঠিক আছে থ্যাংক ইউ আমাদের এই কোড পিনটা অ্যাড করে দেওয়া হয়েছে সবাই এরপরে কি আপনি
Thank you, all committee members. As we approach the conclusion of this significant event, it's my honor to invite Professor Dr. M.A. Mohit Kamal, Chairman, ISSUP Bangladesh Chapter Committee, former Director, National Institute of Mental Health, Senior Chief Consultant, Labate Kardik Hospital, to deliver the closing remarks and vote of thanks.
আপনি বলেন এখান থেকে বলেন স্যার প্লিজ আনমিউট ইওর মাইক
Sir, please unmute it. Yes.
This is Professor Mohit Kamal. Have been collected through online. Distinguished guests, respected Jonah Travis Roberts, Chief Executive of ISSUP,
Sound is not clear.
representative from the U.S. Department of State's Bureau of International Narcotics and Law Enforcement Affairs, colleagues from the United Nations Office on Drugs and Crime, Bangladesh, esteemed professionals and development partners, members of civil society, and dear friends, Assalamu alaikum and good afternoon. It is both an honor and a responsibility for me to chair this historic launching ceremony of the ISSUP Bangladesh chapter. Today we are not simply inaugurating the professional platform. We are talking a strategic Am I clear to you all?
Yeah. Yes, sir.
Yes.
Okay. So today we are not inaugurating a professional platform. We are taking a strategic step forward, strengthening the national response to substance use and related public health challenges in Bangladesh. Substance use disorders are complex conditions. They affect physical health, mental well-being, family stability, social harmony, and economic productivity. Therefore, our response must be comprehensive, coordinated, and grounded in scientific evidence. The establishment of ISSUP Bangladesh chapter reflects our commitment to promoting evidence-based prevention, ethical and effective treatment, and sustained recovery support. As professionals, we have a duty to ensure that our practices are informed by research, guided by international standards, and adapted to cultural and social realities of our country. Though this chapter, we aim to build a strong professional network that connects clinicians, counselors, researchers, academics, law enforcement, policymakers, recovery and community leaders. Capacity building, knowledge exchange, and professional development will remain central to our mission. We also hope to inspire young professionals and students to engage in this field with dedication and integrity. Already we are doing in this field. I would like to express my sincere appreciation to Dhaka Ahsania Mission for hosting this important event and for their long-standing contribution to treatment, rehabilitation, and public health activities in Bangladesh. I also extend heartfelt thanks to our international partners and well-wishers whose guidance and support have strengthened the journey. In the screen, I am just observing one international figure, that is Olha Miss Ha Kibska. Is pronunciation right or wrong? I don't know, but it is from the depth of my mind, just presented to you. Only one and a group figure I am seeing in the screen. So the formal declaration of the ISSUP Bangladesh Chapter Committee and unveiling of our logo today symbolize unity, commitment, and accountability. But the real work begins tomorrow. The success of this chapter will depend on our collective action, collaboration, and sustained effort. Let us move forward with a shared vision, a Bangladesh where prevention is proactive, treatment is accessible, and recovery is supported with dignity, and policies are informed by evidence rather than assumption. I thank all of you for your presence and your commitment and attentive hearing. Together, we can advance professional excellence and make a meaningful difference in the lives of individuals, families, and communities across our nation. May this initiative grow in strength and impact in years ahead. So thank you all. We want to be the part of the global anti-drug campaign, global anti-drug campaign from Bangladesh. So thank you, Ahsania Mission. Thank you selecting me as the chairman of this very important event. Thank you all.
Thank you, sir, for your inspiring closing address. Our online platform, Join different countries, Greece, Philippines, Sri Lanka, Pakistan, Malaysia, and lots of many countries, India also. Give a big hand for them. Ladies and gentlemen, this brings us to the end of ISSUP Bangladesh Chapter launching ceremony. On behalf of Dhaka Ahsania Mission and ISSUP Bangladesh, we extend our sincere gratitude to our respected guests, speakers, partners, and participants for being part of this milestone occasion. Together, let us strengthen professional capacity, promote evidence-based practices, and work together a healthier Bangladesh. Thank you all once again. Have a pleasant evening.